It is universally accepted that parenting is difficult, but now the U.S. Surgeon General says parenting may be hazardous to your health. Dr. Vivek Murthy wrote an op-ed in the New York Times Tuesday titled, "Parents are at wit's end. We can do better." He issued an advisory calling attention to the stress and mental health concerns facing parents and caregivers. A recent study from the American Psychological Association backs this up. It revealed that nearly half of parents report overwhelming stress most days, compared to 26% of non-parents. Dr. Robin Gurwitch joins us now. She's a professor and psychologist at Duke University Medical Center. Doctor, thank you so much for joining us. What's new about this advisory and the moment we live in? Is it that parenting has gotten harder, or the way we think about parenting is harder? What's going on?
Yes. Yes, thank you for having me. I think it's both. I think that parenting has changed. I think things are a little bit more difficult for so many reasons that the advisory laid out. And so as we look at what we're dealing with now, it's not a surprise that parenting is much more difficult. There is the financial strains, feelings of isolation. You know, when I was raising my daughter, I didn't have to worry about AI. I didn't worry about cyberbullying. I didn't worry about social media. I didn't worry about school shootings. So some of the issues facing parents today are very different than they were, say, 20 years ago.
And also what has changed maybe, and just totally shoot this down if I'm wrong, but is that our expectations are that you should be able to teach them Mandarin and make 15-minute brownies in 5 minutes and make sure that they are, exposed to all the wonders of the world, whereas that was not necessarily the case with parenting before.
Right, and be in bed by a reasonable hour, right? So, yes, I think that has changed too. The expectations have changed. And so parents are worried about how they're perceived, how their children are seen. COVID was not a friend of parenting. It raised parenting stress. We're still dealing with that. So parents are still trying to figure out how to cope with the long-term impacts of COVID in terms of learning and depression and anxiety on both the parent side and the child side. So it is much harder. Parents are working harder. And parents are spending time with their kids, but they're stressed about it, truly stressed about, are they doing a good enough job?
And how then, of course, does this affect the children?
Yeah, I think that's a great question, John. It's really bidirectional. When the parents are stressed out, it impacts children, and children's mental health takes a hit, if you will. So we're seeing more anxiety, depression, worry, fears in our children. When children are behaving in ways that upset our parents, then that creates more stress for our parents. So they each impact the other, and the outcome has been much more stressful on both sides of that equation.
So, Doctor, now that we've stressed everybody out who's watching and listening to this conversation, let's talk about any possible solutions. Is there any tiny, small thing that parents can do to kind of reset things? And then let's talk about maybe some bigger, larger societal changes.
Sure. So, yes, all hope is not lost. So what we do know is that there are a few things that make a gigantic difference. One is having a positive relationship with another adult, usually their carer, their parent, their foster parent, their grandparent. If we can think about how to develop that, and it doesn't mean that you need to spend lots and lots and lots of quantity time, but really thinking about the quality time and how do you talk to your children? How do you engage them in pretend play? How do you talk to your adolescent so they think you're actually listening and they're willing to talk back? So we have some tips around how do we do that? How do we get that out there? So that's the bigger issue. How do we make sure that the village that it now takes to raise our children are all working together? So are we seeing policies related to childcare? Are we seeing more efforts being made to give parents some skills that they can use that we know by science actually makes a difference? Are we looking at teachers and schools? Can they help build that parenting to? Can they give children that sense of security and safety in the school that translates into home? So I think it's multiple domains, not just what's happening at home.
And so that would have been what Dr. Murthy calls the shift in policies to make parenting sustainable. Can you give me just quickly a couple of what those policies in specific would be that you were just talking about?
Sure. So, for example, we do a lot of parenting work with teachers, with other adults, and with parents on what can you do to help children feel safe and secure in their relationship with you. So, one tiny thing that parents can actually do, and I know this is going to sound silly, but if you notice something your child is doing well, let them know that you see it. Oftentimes, the only time we're talking to kids is when they've done something that upsets us or stresses us out. We need to change that conversation. We also need to think about, are we talking about social media? Are we connecting parents with other parents? Because again, parents are feeling isolated, and there's another advisory on that, and alone. So can we think about parenting groups so they can see that they're not the only ones feeling stressed?
Dr. Robin Gurwitch from Duke University, thank you so much.
Thank you for having me. I appreciate it.